Tell me right now the correlation between sleep deprivation, while we speak about lung health, overall organ health. What happens when people are sleep deprived? I want to be practical. Every day may not be the best sleep, but when there's chronic sleep deprivation, how does it impact our respiratory system? How does it impact our overall human body?
So we must understand that why is sleep essential? So sleep is essential because nothing can work 24/7. Our body needs the rest. And the way our body rests, recovers and regenerates is with sleep. You have different phases of sleep, and I think everybody's very well aware of N1, N2, N3, REM. I'm not going to go into the science of it, but essentially we have regenerative and restorative sleep. So you can imagine if you don't get the restoration and the regeneration, you will find that a lot of people start feeling fatigued, they wear out. In fact, immunity goes down. For anyone, even if you don't have underlying lung disorders, you don't sleep well for 4 or 5 days, you'll automatically notice that you're picking up infections, you're being prone to infections, you may have a sniffle. So sleep is directly related to immunity. In terms of lung health and sleep, big correlation, because obviously when you have sleep apnea, which is the commonest sleep disorder, what happens is the upper airway collapses. And in general, when the upper airway collapses, you have less oxygen into the body, less oxygen and air into the lungs. And that also sort of causes semi-collapses, or what you call as atelectasis, into the lungs, which again can predispose you to getting infections. Sleep in general, as science has evolved, we know that it's an independent risk factor. So if you have a sleep disordered breathing left unattended, it's an independent risk factor for strokes, heart attacks, resistant hypertension, difficult to treat diabetes with insulin resistance, and also for weight loss, because you have hormonal imbalances between leptin and ghrelin, and both of them are very important for your metabolism, and the ratios get altered, which is why a patient may say that I'm trying my best, I'm not eating much, I'm eating healthy, I'm eating right, I'm exercising 5 days a week, 7 days a week, but I'm just not able to shed those extra kilos, and that's probably the reason why.
Absolutely. We're seeing a lot of people who have been living for sleep apnea without even knowing it. Because in our country, it's considered that, snoring, okay, that's it. But they don't look at getting it checked and addressed. So it becomes a vicious cycle, obviously, because this affects the way diabetes can heal insulin resistance. And at the same time, these people are sleep deprived, which also has the same impact on your blood pressure and everything else that you spoke about. Doctor, what are some of the symptoms that people can start really looking at, whether it's their partners or people that they're sleeping with in the same household, etc., or outside too? What are some of the symptoms that you can, or even if I wanted to do like a self-examination to understand that do I have sleep apnea or not before I come to a doctor? What are some of the symptoms I can look for?
So I think the commonest symptoms that we would ask for and the patient would come to us with is snoring, which may have been aggravated in the last few years, people complaining of a dry mouth, waking up in the middle of the night to pass urine, fragmented sleep, waking up feeling unrefreshed, feeling tired, sleepy, lethargic in the day despite getting a good 6, 8, 10 hours of sleep, and also falling asleep very easily. So these are the common signs and symptoms that we see, and when you have most of them is when we sort of think about evaluating for sleep apnea. A very easy test, which I'm sure all these questionnaires are there online. So the commonest one, the easiest to use, is something called the Epworth Sleep Score, and also called the Stockbank questionnaire. So these are all sort of more medical oriented, but it's very easy. And I think if your Epworth is 11 and above, you can score yourself. It's a very subjective questionnaire. Definitely, I think it's something that you need to get evaluated. Same thing goes for Stockbank, which is history of snoring, hypertension, witnessed apnea. So the partner notices that the snoring happens, suddenly the noise stops and they wake up with a gasp and they start breathing again. So that's when the apneas happen, sleep apnea.
Right.
So these are the few sort of self-testing that you can do. And also again, so the partner's history is very important. So quite often, patients may have read up saying that, if I get diagnosed with sleep apnea, I don't want to live with the machine.
Yeah, that's one of the biggest things.
But again, it's very important that that's not the only therapy that we have, right? It's a scale of things. That is the gold standard. But I mean, if your symptoms are more subtle, or if you're scores are not that severe. There are other alternative uh, uh, devices and treatment options that we have to offer.
So, doctor, since you're talking about that machine, while one is the right people should use it, a lot of people in this new space of biohacking without sleep apnea saying if I use that machine, there's a possibility of, stimulating my upper respiratory system, more oxygen to my brain. Can you talk about the unnecessary use of a CPAP?
So a lot of patients do ask us that why do I need to get tested? I mean, if you feel I have sleep apnea, let me deal with the machine. So I think that's not accurate, not adequate. I think one must get tested because sleep apnea is just one broad spectrum of the entire range of what we call a sleep disorder breathing, which starts from simple snoring to sleep apnea with complex apnea and hypoventilation syndrome. So it's a big spectrum that we need to evaluate. Just putting on a CPAP machine, in a way, it's not detrimental, but I think if you don't have it, you don't need it, you shouldn't use it.
Absolutely. Doctor, what about, there are some people who have these snoring symptoms, but it's not all the time. And it's not the one where they wake up in the night or their partners know that their breath, suddenly stops or they gurgle and stuff like that.
Yeah.
A lot of people have reported that, when they're jet lagged or they're tired for 1-2 days, they have this low snoring that happens. When their sleep's back in place, everything is good, it disappears.
Yeah.
And it happens, is it possible that when the body's extremely tired, snoring can increase?
Absolutely. So excessive fatigue, alcohol, both of them are known to aggravate snoring. So as I said, snoring in itself, it's part of the spectrum of sleep disorder breathing, but snoring in itself is not dangerous. So I think one must understand what snoring is. So as we all go to sleep, our back of the throat is made up of muscles. So when we sleep, as our body relaxes, the muscles relax. So the caliber of the airway reduces. So when the caliber of the airway reduces to a sort of minuscule aperture is when air passes through resistance. And when air passes through resistance, it makes noise. And that noise is called snoring. So you don't have complete cessation of flow, but you have impedance to flow. So your flow slows down, but you don't have stoppage of breathing. So the oxygen doesn't dip, which is why snoring in itself is not dangerous. Obviously, it's an irritant to the bed partner, but not to the patient per se.
Yeah.
Again, if you have subtle symptoms of snoring with no other comorbidities such as heart trouble, strokes, hypertension, diabetes, again, I think you may not need to get a full evaluation done. And if you know your triggers, I mean, obviously we live in a stressful environment, long working hours, less sleep. I think a little bit of sleep hygiene is important. But if there's any more of those symptoms that we mentioned earlier, then definitely one must get tested.